Hi guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we have a special guest, our COO Kelly Herbert, who's going to be asking me some, hopefully not too difficult questions, but some difficult questions.
Well, thanks for having me. We're going to jump right in. I am really excited about today's topic. It is very near and dear to my heart. We're going to be talking about facelifts in your 40s. And as someone who is in her late 40s, I'm really excited to ask you a few questions today. So I'm starting to see, Dr. Ladner, I'm starting to see some changes just in my lower face and in my neck, under my chin. It's just starting to feel not as tight as it used to be. And I do all the things with good skincare and proper hydration, lots of rest and protein. But I think at some point, surgery is really our only option. But I'm worried that I'm in that kind of weird phase of looking done or looking refreshed. And so how would you approach women in my age range who are kind of on the borderline, but we don't want to wait until our faces are falling off to have a facelift?
Yeah, great question. I think multiple layers to the answer to that question. So first of all, most importantly, I don't operate on a number.
Okay.
And when someone comes in for a consult, I'm not really considering their number, right? Because someone could look better at 60 than their peer at 46,
Okay.
as an example. So I think that there's more important factors that play into it beyond the number, right?
So what are those factors?
Yep. So number one, pervasiveness in the thought. So in other words, it might have been a fleeting thought 5 years ago, but now you're seeing yourself in the mirror every morning. You're looking at it. You're bothered by it. It's affecting your confidence, perhaps, or maybe not even confidence, but you just want to look as good as you possibly can. So you're thinking about it more commonly, right?
Okay.
And then there's the objective side of things, or at least what I consider to be objective, where I'm going to try to take a step back and really look at the severity. Okay, am I seeing what they're seeing? Because I do a lot of these. And I can compare that individual to the whole spectrum of patients that I've operated on. And if I truly feel like, yeah, maybe it is a little bit too early, right? Because we can't justify the procedure with the result you're going to get, even if it's a little bit better. Maybe you don't want that 2-week downtime, right? So I'm definitely going to look at the severity. But I try not to focus on the age, right? And so I feel like if we are on the same page, and even if you're only wanting 3, 4, 5, 6, 7 years of results, and that's going to justify going through the process and the downtime, then it's absolutely appropriate.
That makes a lot of sense. And I love that you say that it's not about a number, because now with so many people using GLP-1s to help with either weight loss, blood sugar control, or even just inflammation, we know the research there tells us that GLP-1s can be great for a lot of reasons beyond weight loss. We do know that it does oftentimes with weight loss cause a sagging of the skin on the face, fat loss, that volume loss we talked about in previous episodes. And so I think really taking the number away and letting a qualified facial plastic surgeon such as yourself to say, now is the time, whether you're 38, 48, 58, that makes a lot more sense to me. So I shouldn't feel bad at 47 or 48 or 49 or 50 if I need a facelift before maybe someone I knew that didn't get one until they're 60, right?
That's right. And there's definitely been a paradigm shift over, the last few decades. And I think that, things like Botox have probably helped this because, people are using Botox preventatively, right? Because they don't want to ever form the lines in their foreheads and their crow's feet. So they say, hey, if I start now, I'm actually going to get more bang for my buck because those lines will never appear, as opposed to chasing those lines, right? Yeah. And I think that a lot of people, because of how popular these procedures are, how much the public is now aware of these procedures with social media and digital media, I think that people are viewing surgery now a little bit more preventively than they did in the past, right? They would let things get really, really bad. 65, 70, they say, okay, let's do it all. And I think that the trend is that, again, people want to look as good as they feel. They always want to look, show their best face. And they're saying, hey, even if it's not that severe right now, if I do a procedure, I'm going to maintain what I have. Right? I want to always look like this. I want people to be blown away when they learn my actual age, right? It's not that we're trying to make someone who's 46, 47 look like they're 21, but I want their friends or colleagues or people they're meeting rather to say, I can't believe you're 46. You look amazing. right?
So yeah, and I think that's the number one comment I get from patients in our office, male or female, is they say, gosh, I don't want to look done. I don't want people to know I've had this done. Some people are open, but many people have plastic surgery in a discreet manner. They hide themselves away for a few weeks. They take PTO from work, whatever
Yep.
that looks like for their personal situation. But then they worry about what the final outcome will be, and they don't want to look like some of the things that you see on social media where, big lips, lots of, whether it's filler or fat grafting that's overinflated and really tight pulled skin, kind of like we've talked about in previous episodes with that windswept look. We still see some of that, and people are intentional about wanting that look. I think most men and women in their 40s, 50s, and beyond, they just want a natural look. So when you're thinking about a patient and taking their goals into account, what does natural mean to you, and how do you achieve that?
Yeah, I mean, I think it's interesting because, and it's becoming less common, but I think patients' fear of looking overdone, looking like they've had surgery. It's interesting because that's really never a fear of mine for my patients. And I'm not just saying that. I don't have patients come back to my office post-operatively and say, oh my gosh, you made me look too surgical. Fat grafting is actually a very good example of this. Our fear sometimes as surgeons is that they're going to get a great result with fat grafting, but maybe only 80% of the fat survives. And we wish maybe a little bit more would have survived, right, for that just home run perfection, right, even though they're getting a great result. And so no matter the age of the patient, whether you're 40 or you're 50 or you're 60, that really should not affect looking done per se. And in fact, I think that my 40-year-old patients, my 45-year-old patients who have young, healthy skin, if anything, they're going to be less likely to look done because that result matches that beautiful, young, healthy skin that they have.
That makes sense. So because we're talking about women in their 40s today, what are the most common procedures you're seeing in our office for women in their 40s? Is it eyes? Is it facelifts? Is it fat grafting? How are people rejuvenating in their 40s?
It's all the above.
All the above.
Okay. So, eyes are a great example of this. I'm doing lower blepharoplasties in men and women in their 20s because they genetically have large bags or they have hollowness underneath their eyes. So we're doing a lower blepharoplasty with or without fat grafting or fat grafting alone. And so again, that's a perfect example of how age really has nothing to do with it. It's more genetics. I'm doing neck lifts in folks that have had double chins, maybe because they have a recessed chin from a bony standpoint, or they just have a saggy muscle that runs in their family. And so we're doing those procedures very naturally in folks as young as their 20s. So again, we're not looking at that specific number. But to answer your question, we're doing all of these procedures: brow lifts, upper blephs, lower blephs, fat grafting, CO2 lasers, facelifts, neck lifts. We're doing it in all ages, right? And so again, it's going to be individualized to when it's appropriate for that person. And it may not be appropriate at 40, and they think it's appropriate, and I tell them, maybe we need to wait a little bit, right? But I've seen patients in their 40s or their 50s that look really farther advanced than people in their 60s and 70s. So a lot of genetics plays into this, and we have to assess each individual as an individual.
Yeah, so I know that we aren't putting a number on things, but just speaking again as a woman in her late 40s, have a couple of crazy boys at home that keep me very busy outside of my work life. I probably don't get as much sleep because I've got a million plates that I'm spinning. I do exercise, I do eat well, but still at the end of the day, I want to feel refreshed, and I want to feel as young and as good as I feel on the inside. I want that to match on the outside. I think many women in my decade would agree with that. And I think that the number one thing that I hear from friends who are moms, or even if they're not moms, they're fur moms, it's the eyes that really kind of start to give way in their 40s. Aside from weight loss, changing the face structurally and so forth, most women in their early to mid 40s still have a good amount of fat in their face and collagen and so forth. But the eyes really start to tell the story of being tired. And I think that's what I see when you bring a woman in her 40s in who is a good candidate for an upper and or lower blepharoplasty. Oftentimes you'll partner that with a fat transfer with the lower blepharoplasty to help with that hollowing right around that orbital bone there. for me, I think that's the number one way a woman in her 40s could look refreshed if she's a good candidate is by changing the eyes and giving that more rested look.
Yeah, absolutely.
And it's such an easy procedure.
Exactly, yeah. And pain is very minimal with those procedures. The level of invasiveness with those procedures is quite low. But yeah, that's a great point. All else being equal, I always tell my patients that what are other people looking at? Well, they're looking at your eyes in conversation, right?
Yeah.
And so let's say that you're on the fence and you say, I don't know if I'm ready for the neck lift yet. I'm not sure if I'm ready for the eyes yet. Which one would you do first? Quite honestly, if you're choosing between the two, I'm probably going to direct them to do the eyes, right? Now, if they need it all, then obviously I'll advise that. But that's because other people are actually seeing their eyes, right? And may not be staring, say, at their neck as much as their eyes.
Right.
Yeah, it can make a huge difference.
Yeah. Now, what about the patients who come in and they want to look younger? So what if I came in and said, Dr. Ladner, I'm almost 50, but I want to look just above 40, right? That's a 10-year age difference. Am I being realistic in that? Or women needing to accept that we're just aging gracefully and we can look refreshed but not younger? Or what would you say? Because I do hear that from my friends as well. It's like, God, I wish I could just look 10 years younger.
Yeah. And I think, honestly, realistically, that's where if people bring in photos of how they used to look 10 years ago,
Okay.
right? Because we do a pretty darn good job of getting people back to where they used to be. And actually, there's sometimes where we get people above and beyond where they used to be. So like a double chin is a good example of that. If they don't have that nice bone structure, then we can do things to improve the bone structure that they've never had, right? But if they come in and they have a photo and let's assume that their skin health is really good and they show a photo of when they were 40 and now they're 50, I think it's very realistic to say, yeah, we can get you back to that appearance or close to that appearance. It may not be spot on, but it's going to be close. The aging gracefully thing, what I remind, and this doesn't happen as often anymore because there's, now so much more public knowledge of what we're doing as facial plastic surgeons. But I remind them that they're doing a lot of other things to age gracefully, okay? So in other words, they're eating well, they're exercising to take care of their body, right? Both from just an appearance standpoint as well as an actual internal physical health standpoint.
Yeah.
They're going to the dentist to clean their teeth because they don't want to have teeth that stand out to people. So we're doing it. They're going to the hairstylist and spending $500 every 3 months, right? So eyelashes, nails, all of these things are very in line with what we're doing with surgery, and that we just want to make people look as good as they feel on the inside, right? No different than those other modalities.
That makes a lot of sense. Well, I'm really excited to have had this conversation with you today. I think the best thing that women in their 40s can do is just come in for a consultation.
Yeah.
We do virtual consultations if you're not local to Colorado. We would love to see you in person, but I think really it's just, we don't do things by a number, as you've said multiple times. It's really about, do you look how you feel? And if not, come in for a visit and let us help you achieve those goals.
Yep. Yeah. And one word kind of boils it down, and that is confidence, right? So yes, we're in the industry of making people look as good as they feel, making them look good for their stated age, rewinding time a little bit. But in a lot of ways, it's also about either rebuilding confidence or giving them new confidence that they never had.
Wonderful. Well, thanks for answering my questions today.
Thanks for being on the show today. And if you like what you heard, please be sure to like our video and subscribe to our channel.